Paramedics have likened Sydney's hospital system to the Titanic sinking. They say some hospitals are buckling under the pressure of COVID-19 and they desperately need more resources. But the state government insists the hospital network is coping. Cases jumped today to a new daily record, and another man in his 80s with underlying health conditions has died. Tim Swanston reports.
All I can think about my children that I haven't seen in a very long time.
A sobering dose of reality on Sydney's COVID wards.
I'm not doing too well at the moment.
Many of my patients have terrible cough, the sort of cough that leaves you breathless.
Dr. Lucy Morgan treats some of the city's sickest.
It was harsh.
They just can't eat anything or drink anything. And people feel so overwhelmingly fatigued, it's all they can do is to lie on the bed.
The number of patients suffering these severe symptoms keeps growing, and the health system's under so much pressure, hospitals are pivoting to an emergency footing.
From what we can see, the government appears to just be shuffling the deck chairs as the Titanic is sinking.
To avoid the icebergs, Westmead Hospital says it accepted fewer COVID arrivals for 24 hours. But paramedics say it and Blacktown Hospital weren't taking any.
Very frequently we have short staffing overnights in the afternoons. We have people chucking double shifts, which means they could be working 16, 18, sometimes even 20 hours.
In a letter to staff, Westmead's general manager said it was setting up an emergency operations centre and the hospital is no longer operating business as usual.
Westmead Hospital is typical of the sorts of pressures that you'd expect.
It is at breaking point. This is extremely concerning.
On average, about 75 COVID patients are turning up to Westmead's emergency department every day. Right now, there are more than 120 people staying in the hospital. About 24 need intensive care. To reduce the strain, Westmead's planning to open another 100 beds at the private hospital. On top of that, Westmead's looking after 1,500 patients at home. That's only going to increase as cases climb. There was another record today, 919, and a man in his 80s has died. But the Premier's focused on another number.
The most important figure moving forward is the rate of vaccination.
More than 125,000 people got the jab yesterday, meaning almost a third of eligible residents are now fully vaxxed.
2 doses of COVID-19 vaccination will be your suit of armour.
And the state's best defence. Tim Swanston, ABC News, Sydney.
There are growing concerns for the Indigenous community in Sydney's west and southwest. One major community organisation says it's regularly running out of vaccines, even though it services people who should be getting priority access.
It's months into the rollout and there's still not enough vaccine to go around.
That's it. I want to know why, in the most dangerous part of the country, we're not getting those doses to vaccinate the most vulnerable.
Almost 1,000 jabs have been administered at the Gandangara Health Service in Sydney's southwest, half of those going to the local Aboriginal community.
People are very grateful to be able to come here and get vaccine.
We're looking at 13,000 people. That's just according to census, but put another 30% on top and you get the numbers. So if we're only doing, say, 1,000 vaccines so far, we aren't even there.
About 10% of Indigenous Australians in New South Wales have been fully vaccinated, despite being a priority group. While more doses are expected, lack of supply isn't the only concern.
Our staff are working 12, 13 hours a day to make sure mob are being safe. They're burnt out. It's been a huge strain on the limited resources and staffing that we do have. The government needs to respond stronger and quicker.
Despite the lack of supply and support, hesitancy has been another challenge. But health experts say the message is getting through.
We're seeing through Aboriginal community-controlled health organisations is that they are flat out giving vaccines at the moment, which is a really good sign for the Indigenous community. They're heeding the message, they're taking that on board and they're going out and getting vaccinated.
Community leaders say more vaccine hubs are needed.
Let's get the clinics to the people.
A desperate plea from a concerned community. Nakari Thorpe, ABC News, Sydney.
The virus is continuing to spread across regional areas. There are 49 new cases in Western New South Wales, 35 of them in Dubbo. The Far West has 7 new infections. Illawarra Shoalhaven recorded 8 cases and Hunter, New England 4. There was 1 new case on the Central Coast. Sewage surveillance has picked up the virus in several locations. Authorities are most concerned about Merimbula on the far south coast because of its proximity to Canberra.
It's been an area that's been quite clean from COVID for a very, very long time, and we are asking the community to come out and be tested